Hi, Iron.
Hi.
Hi, Dr. Guai.
Nice to meet you.
Nice to meet you. How are you doing today?
I'm good. How are you?
I'm good, thanks. All right, so I know this is your first time to our clinic here. What is it that brings you in today?
Well, my right ear has been bothering me a lot.
Okay, all right, so I'm going to get some more information about that. How long has that been going on for?
A couple of weeks now. I've had problems with both my ears on and off pretty much my whole life.
Okay.
Up and down. I've had tubes in the past. I've had drainage. But now it's primarily the right ear that's bothering me.
Okay. All right, so just as a background, you said you've had tubes. How many set of tubes do you think that you've had in the past?
At least 5. I've lost count.
Okay.
Sorry.
And when was the most recent time that you had some tubes?
I think it's been a couple years.
Okay.
I haven't had problems with this ear in a while, and now that it's bothering me, it's really bad. It's full. The pain, it's not just in my ear, but it feels like it's just going everywhere, like to my jaw, all over my face when it gets really bad. And the thing that really bothers me is that I feel like my hearing is not as good. I feel like I'm constantly asking people at work, like, what did you say? And people are getting frustrated with me.
Okay, so you're having some problems at work.
Yeah.
And what is it that you do for work?
I work retail. I sell shoes.
Okay. All right. And the tubes that you've had in the past, has it been both sides or just one side?
Both sides.
Both sides?
Yeah.
Okay. And any background history of any ear trauma otherwise?
No.
Any other ear surgery that you've had?
The tubes.
Yeah. Okay.
Other than that, no.
Other than the tubes, no. Okay. I'm just going to ask some other questions about the ears.
Okay.
Have you had any draining from the ears at all?
Right now?
Yeah.
With this episode?
Yeah.
No, not with this one. I feel like it's just like something's going on and it hasn't like popped or whatever. I've had that happen before where it pops and it drains, but I don't know. Right now, nothing's draining out.
Okay. Any problems with dizziness at all that you're having?
No.
No? Any fevers that you've had recently?
No, but I haven't checked either.
Okay. And any problems in terms of with the nose at all, in terms of sinus problems?
A little bit of drainage, but also I have seasonal allergies.
Okay.
So, but nothing other than that.
Okay. And are you on any medications or treatment for the allergies?
No.
No? And have you been tested for allergies?
I
in the past?
have. I'm allergic to ragweed, and that's what's like the pollen's really high for ragweed right now. So
Okay.
it's really bad right now.
All right. Any associated neurological problems at all?
I don't think so.
No weakness, no funny
No.
sensations or anything like that. Okay.
No.
Anything else about the ears that you think is important for us to know?
Not really. You've kind of got all the important stuff.
And I know you've had a chance to fill out our information in terms of your past medical history. I'm just going to go through that with you just to make sure we have all the right information.
Okay.
In terms of your past medical history, the recurrent otitis media that you talked about, the tubes in the past, but otherwise pretty healthy, so that's great. In terms of medications, using some Advil for pain, azithromycin every once in a while for URIs. In terms of allergies, no known drug allergies. Your family history, you have a mother and a sister with hypothyroidism. And just need to ask some social history questions as well. We ask these to everyone. Are you married, single?
Married.
Okay. And you said that you work outside the home in retail. And we ask everyone these questions. Are you a smoker at all?
No, I'm not.
Okay. And do you drink alcohol at all?
No.
Okay. All right, and just in terms of the review of systems questions that you filled out, just to make sure everything's the right information. The nasal drainage you mentioned, have a little bit of headaches every once in a while, but no problems with swallowing, no pain on swallowing, no dry mouth. And you don't have any history of weight loss, fevers, chills, or sweats. No problems with the heart, breathing, a little bit of asthma. No nausea or vomiting. In terms of going to the bathroom, urination, that's okay. No weakness, neurological problems, nothing there, and no history of easy bruising or bleeding.
No.
Is that correct?
That's all right.
All right. Anything else important for us to know before we check a few things out?
No.
No? Okay. Just going to give a listen to your heart and your lungs and the belly first. And lean forward for me, please. Deep breaths in and out through your mouth. Great, you can lean back. Just going to listen to your belly here. Stare straight ahead. Take a look at your eyes. Sorry about the bright light. Great. Just follow my finger with your eyes. How many fingers do you see?
One.
Good. How many there?
One.
Good. How many there?
One.
Good. How many there?
One.
And how many there?
One.
Good. Feel this on both sides?
Mm-hmm.
You feel that on both sides?
Mm-hmm.
Feel that on both sides?
Mm-hmm.
Great. Clench your jaw for me. Good. Relax. Good. Close your eyes real tight. Don't let me open them. Good. Open up your eyes. Puff out your cheeks. Pucker up your lips. Smile. Okay, good stuff. Turn your head to that side. Don't let me push you. Turn your head the other way. Don't let me push you. Good. Shrug up your shoulders for me. Good. Look at your ears there. Just turn your head to the side a little bit. Great. So this side does look like there's some fluid there. You feel a little bit of puff of air, okay? And it doesn't look like that eardrum's moving too much. This side looks pretty good. Puff of air again. And that's moving well, so that's great. Just gonna take a look in your nose. Tilt your head towards me. Good. Everything there looks fine. And take a look in your mouth. Look up your mouth. Good. Say ah. Go ha ha ha. Good. Lift up your tongue. Good. Move your tongue to one side. Good. Move your tongue to the other side. Good. Relax your jaw a little bit. Good. I'm just going to check and feel some of your glands around. Just open up a little bit. Good stuff. Just going to feel your neck here. Gonna just check your thyroid. Swallow for me. Good stuff. All right, great. So I know before you came here as well, you had an audiogram here, a hearing test. So I'm just going to talk to you a little bit about that. Your left side looks fine. The hearing's good. The eardrum moves good. On the right-hand side where you're having problems, it does show a moderate conductive hearing loss. There's options of where we go from here. I know you've had some tubes in the past. And we can get some tubes in again for you on that side.
Okay.
In terms of benefits of that, that should help in terms of the hearing and also help in terms of some of the pressure feeling that you have in the ear. In terms of the alternatives for that, we can continue to watch it and try treating with medical treatment. In terms of the risks of procedure, anytime we do a procedure, we have to talk about potential risks. This is one of the most common procedures that we do, and it's a pretty straightforward procedure. There's a chance of getting drainage from the ear. There's a chance that when the tubes fall out eventually, that there can be a persistent hole in the eardrum. And there's this very, very small risk of structures in the ear area. So the bones that conduct your hearing and the facial nerve in that area as well. But like I mentioned, it's a very straightforward procedure. You've had it done in the past, so that the risks are pretty small. Are you interested in going ahead and getting some tubes?
Yeah, I've had tubes many times, so I'm pretty comfortable.
Okay, so it sounds like you're interested in the tube, so we can do that for you today in clinic here. What we're going to do is go to the room next door.
Okay.
We're also going to do a flex scope of the nose area to take a look at the nose, the nasal pharynx, and the voice box. Just make sure there's nothing else going on. And then we'll take a good look under the microscope at your ears, get that myringotomy and put a T-tube in for you. And then after that, we're going to get you on some Ciprodex drops.
Okay.
And we'll see you in about 6 months' time.
Okay.
All right?
Sounds good.